We have a very timely current issues and effective practices presentation by Jonathan Mederios, Government Relations, U.S. Policy at Pfizer. This presentation was developed in collaboration with Tom Brownlee, Director of U.S. Policy at Pfizer. Jonathan will be giving a presentation on policy and legislative updates as it relates to the Accumulator program. Jonathan.
Thank you, Stephen, for the introduction, and appreciate the opportunity to speak to you all today. So over the next few minutes, we'll be discussing accumulator adjustment programs and some of the policy and legislative developments that have been happening at both the state and the federal level to prevent their use. But before we get into some of that work, I just want to do a quick refresher on what is an accumulator adjustment program for all of us on the phone. So an accumulator adjustment program is a benefit design that's been offered by pharmacy benefit managers, and it's often provided to employers to prevent the use of copay assistance programs for prescriptions from counting towards a patient's deductible or annual out-of-pocket max. Now, traditionally, and before these programs, copay assistance and other support resources from pharmaceutical companies or manufacturers would count towards the patient's deductible and annual out-of-pocket cap when a patient pays for a medication. Now, when an accumulator adjustment program is utilized, copay assistance may be used, but the patient will still need to satisfy their full out-of-pocket cost maximum for the year. So just a quick example to help illustrate this. Let's say a patient that's using a copay resource from a manufacturer for a treatment, it covers their cost for 4 months, but starting in May, they would need to start paying their deductible because the assistance would run out. This is different than in a normal scenario of having the assistance count in January for the patient towards their deductible. And as you can imagine, this can create unexpected financial hardships for patients later on in the calendar year. So for a quick educational resource and really a great backgrounder on the issue, I would encourage all of you to look at the Ncoda accumulator adjustment resource that they put together. And it's a great backgrounder. And then on one side of it, it provides a good graphic of two receipts, one showing a cost exposure example for a patient where there isn't an accumulator adjustment program and one where there is. So given the increased burden and hardship that's been observed, and Stephen, if we can move to slide 2, 5 states have introduced legislation to address this issue. At the state level, the objective of these bills is to ensure that any assistance that's provided to patients for a prescription counts towards the deductible and the annual out-of-pocket cap. Now, legislation at the state level would apply to any state-regulated commercial plan. And then at the bottom of the slide there, at the federal level, CMS recently published their Notice of Benefit and Payment Parameters. It was actually published on January 17th. And CMS proposes these rules annually to set forth regulation for the ACA. And of course, these regulations would apply to all commercial plans across the U.S. So amongst all the proposed rules that was provided on January 17th, there was one accumulator proposal that would exclude the use of coupons or copay assistance from counting towards a patient's annual out-of-pocket cap for brands that have an AB rate equivalent. So this rule has been interpreted different ways, and many stakeholders are submitting comments to CMS to get some more clarification on what this means. But one way that this has been interpreted is that this proposed rule could mean that these programs or copay accumulator programs are not allowed outside of the proposed rule. So for example, an accumulator adjustment program could not apply to specialty medications where there is no generic equivalent. And as many of you could imagine, these are the type of treatment scenarios where patients often need the assistance the most, and thus copay accumulator adjustment programs would not be allowed in these scenarios for these patients. So the last thing I'll say, just to sum up this presentation, the one thing that's stakeholders that are engaging on this issue at both the state and federal level, what they're looking for are examples and stories of where this might be occurring, patient examples, or maybe from physicians where they're interacting with patients. So if there are any examples that you're seeing out there, and Stephen, I'll volunteer you and Ncoda to pass them along to you, because I know this is a priority policy and engagement issue for your organization to do that, because the stories are definitely needed. And with that, once again, thank you for the opportunity for us to join the call.
Yes, Jonathan, thank you. And Tom, we really appreciate the education, and we'd be happy to forward any of those stories along. And as Jonathan mentioned, Ncoda has created an informational trifold pamphlet regarding copay accumulators. To obtain copies of these educational trifolds for your practices and patients, please email contact@ncoda.org. Jonathan, again, thank you.